Hi, my name's Sharon. I'm a practice nurse with Lister House Surgery. I've been a practice nurse for about 20 years and I'm here to tell you a little bit more about cervical screening. Cervical screening, or as most of us ladies know it, smear or pap tests, are simple tests where we collect a sample of your cells from your cervix and we're looking for the presence of a human papillomavirus, which is more commonly known as HPV. Most people will get some sort of HPV during their lifetime. It's really common and it's certainly nothing to feel ashamed or embarrassed about. In most cases, your body will actually get rid of the HPV virus without it causing any problems. But occasionally, HPV can stay in someone's body for a long period of time. The screening programme in England is offered to all ladies aged 25 to 50 every 3 years. When a lady has had her test over the age of 50, she'll then be invited to attend every 5 years. This is because they know ladies over the age of 50, their cells will change at a slower rate than those under 50. During the appointment, a sample of cells is taken from your cervix, which is the opening of your womb and located at the top end of your vagina. Our nurses can answer any questions on the day that you may have related to your smear, and there's no such thing as a silly question. We have lots of confident ladies, we have lots of anxious ladies, and we're more than happy to talk you through the whole procedure and answer anything that you're not sure about. This is a fairly quick procedure where we will ask you to remove your clothing below the waist and lie on our bed. We do provide a modesty sheet, and ladies, please do not be concerned. We don't care that you have or have not shaved your legs. Honestly, we've seen all shapes and sizes, including the odd one with glitter. And although slight discomfort may be caused, the procedure should not be painful. And of course, if you wish us to stop at any time, you only need to say. It really is not a problem. Embarrassment is the biggest barrier to ladies coming for a smear test, and it's really not needed. We're going to look after you during the appointment. We have a little plastic tool which we call a speculum, and the varying sizes in this. Your nurse will usually start with the smallest one she can, and we also use some gel or some warm water to try and ease entry into the vagina, and we only open it slightly just to allow us to see your cervix. We then use a soft brush and sweep the cervix 3 to 4 times to harvest the cells. The speculum is then removed and we leave you to get redressed. Our doors remain locked during the procedure. We also have a curtain for privacy that goes around the bed. We try and keep this as dignified as possible, and you are more than welcome to bring somebody with you for support if needed. Your results will be provided within a letter, and this usually arrives with you within 4 to 6 weeks of the test being taken. Occasionally there are delays at the laboratory, and if that's the case, the nurse on the day will let you know. Sometimes there is a need to retake the test, and we have to wait 3 months to do this. That does not mean there's anything wrong, it's because the results were unclear, and this can sometimes be known as an inadequate result. There are different types of results that you may see in your letter, one of which is that the human papillomavirus is not found in your sample. This is known as a negative HPV result, and this applies to most people. This means that your risk of getting cervical cancer is very low. You do not need any further tests to test for abnormal cells, and you'll be invited for another screening dependent on your age in 3 or 5 years. Should HPV be found in your sample, your results letter will explain what will happen next. This is known as a HPV positive test. There are 2 types of HPV positive results. When the HPV virus is found, but there are no abnormal cells, you will be invited for screening in a year. They will repeat this after 2 years if you still have the HPV present. If you still have HPV present after 3 years, you may need to have a colposcopy. This is a procedure that is performed in a similar way to a smear test, but with a more detailed view of your cervix, and you will be invited up to the hospital for this procedure to take place. The other type of result is when HPV is found but with abnormal cells. This means that we need a more detailed look at what's happening with the cells in your cervix. This is done via colposcopy at the hospital, and they will automatically send you an appointment. Many cell changes go away on their own, but some may develop into cervical cancer. Colposcopy helps identify whether cell changes need treatment to stop this from happening, and it's really important that you attend, as they can often treat abnormal cells on the day. The nurse who took your original sample will also be aware and will be telephoning you to provide some extra support and advice surrounding colposcopy and what to expect. Here at Lister House, we try and make smear appointments as available and flexible as possible for our ladies. We provide a variety of appointments throughout the week, every week, and some Saturday morning appointments are also available most weekends. Our appointments can be booked in a variety of ways, and usually when you're due a smear test, we will send you an SMS message containing a link that will allow you to book an appointment online at a convenient time and day for you. You may also book a smear test by calling the surgery at 01332 271 212 or pop into any of our sites and book at reception. If pre-bookable appointments don't suit you, we also offer a simple walk-in service on a Saturday morning several times a year at our various sites. Ladies, for the vast majority of people, a smear test is simple, routine and just a precaution. However, there are a few ladies for whom a smear test can save their life. Please come and talk to us about anything that may be preventing you from taking the test.